Well, it won't prevent you from getting coronavirus, but it might help catch it earlier. And WJZ is live at the Baltimore City Health Department right now. Paul Gessler shows us the device that's flying off pharmacy shelves and why a local synagogue is spearheading efforts to get it to vulnerable communities. Paul.
Hi, Denise. Yeah, these pulse oximeters measure the saturation of oxygen in your blood. Anything between 95 and 100, that top number there, is normal. That's important because COVID-19 can go after your lungs and cause severe drops in your oxygen. This $35 device might catch that drop in oxygen before you get symptoms.
Oxygen saturation level, that's the percentage.
Rabbi Miriam Burg of Beth Am Synagogue shows us her pulse oximeter, which tracks oxygen levels in the blood.
I thought, here's something that I can do that no one else is really focused on.
Burg learned about them from her cousin during a family Zoom call. It just so happens her cousin is Dr. Richard Levitan, an emergency physician who treated patients at Bellevue Hospital in New York.
Within about 10 seconds or so, it displays your heart rate and your oxygen level.
Levitan told CBS News COVID-19 attacks primarily through the lungs, usually 5 to 10 days after infection.
People were showing up with oxygen levels of 50%. Now, this matches the level of oxygen that we've measured on the summit of Mount Everest.
This device could detect lower oxygen levels earlier. Enter the Burg family.
All of a sudden, there's a mass crisis in the country, there's a pandemic, and there's got to be something I can do to help.
Daughter Elia donated $1,000 from her bat mitzvah money, matching some of the donations to buy pulse oximeters for vulnerable communities here in Baltimore.
Amidst all of the searches for cures, there's an opportunity to do something that's really preventative and really easy.
They set a $4,000 goal.
We actually passed the goal, which was amazing. As we got more and more donations, it just turned into a feeling of awe.
Now it's nearly $8,000.
Which has been enough to purchase and distribute 200 of these oximeters already. I feel pretty confident that what we're doing is going to save somebody.
Now, even if your oxygen levels are normal, that does not mean you are COVID-19 free. Again, you can be asymptomatic, but this can be a warning sign to get you to your healthcare provider earlier. For now, reporting live at the Baltimore City Health Department, I'm Paul Gessler for WJZ.